Hi everyone. My project is establishing a preoperative guideline on when to perform an ECG or electrocardiogram on patients in a small day surgery. But why do we need this guideline? Well, basically, doctors have encountered cardiac arrhythmias while patients are being operated on, and there was no baseline ECG. Also, there has been a gap on which patient population will perform the ECG. And more importantly, we need to recognize cardiac arrhythmias as it can cause further sickness and worse, death to our patients. Given this project aims to establish a local hospital guideline on preoperative ECG testing. We will also ensure that ECGs were performed on all patients with documented cardiac risk factors or history. To do this, we need to identify the gaps in the setting. In terms of manpower, nurses are unaware of the risks. Also, patients are not disclosing the relevant cardiac history. Doctors sometimes have different opinions and or preference for ECG testing. In terms of the environment, sometimes there are no suitable area to conduct ECG testing. In terms of equipment, there is only one ECG machine in the entire hospital. And for the processes or the methods, pre-op calls not comprehensive in asking cardiac history. Also, there are many paperwork and forms to complete and are often repetitive. And obviously, there is no definitive ECG guideline. But what would the process look like? So basically, patients with cardiac clinical risk factors, which we will discuss in detail later on, would be assessed via pre-admission calls and during admissions. During the pre-admissions call, the nurses call the patients days before their surgery, and they will ask recent cardiologist appointments and next follow-up. If they've been seen by the cardiologist and they are in between their appointment times, they can proceed with surgery as scheduled. If they are due for a visit, we will suggest that they do this prior to their surgery. We will also ask them for their recent tests, such as pacemaker checks, creatinine levels, and cardiac biomarkers such as troponin or any test that their cardiologists think that they need. If their tests are within normal range, they can proceed with the surgery. If their tests are abnormal, they would need to be seen by the anesthetist to discuss further instructions. Now, during admissions, when these patients come to the hospital, we will perform ECG and then we will report this to the anesthetist and the surgical team. Now, let's talk about the cardiac risk factors. So basically, patients who has any of these factors will be included in the ECG guideline. And these cardiac risk factors are derived from the European Society of Cardiology and the European Society of Anesthesiology. They are patients with ischemic heart disease, angina pectoris, and or previous myocardial infarctions, patients who had heart failure, patients who's got renal function that is way below their normal range, also patients with stroke or TIA, and patients with diabetes requiring insulin. This will be a continuous improvement project, but how will we measure practice improvement? Basically, the percentage of patients with cardiac clinical risk factors will have an ECG performed on admission by 100%, meaning we will want all the patients with this history to have an ECG, and we will want to be completed in 3 months. To do this, we will basically do a tally sheet that designated nurse will complete at the end of the day that will determine whether an ECG was performed to patients who have one or more of the cardiac risk factors. It's also through consultations, brainstorming, and meetings with anesthetists, surgeons, hospital clinical executives, and nursing staff. It's also through quarterly reviews of documents and audit results. And finally, how would it look like? Well, for the people, the nurses will be educated on preoperative ECG guideline, and patients will be asked detailed cardiac history during pre-op calls. And the doctors will be consulted regarding their opinions and their preference for ECG testing. We will dedicate a space in the admissions recovery area for ECG testing. As there is only one ECG machine in the entire hospital, that is sufficient. It's a small day surgery, and that would be enough. For methods, pre-op calls will be comprehensive in asking cardiac history. There will be ongoing consultations in regards to paperwork or forms to be completed. And finally, there will be a published ECG guideline.